You first need to open the video that is being streamed live. Look for the chat box on the side or bottom of the video player. This is where you can type your message. Click inside the chat box and use your keyboard to type out what you want to say. You can type words, use emojis, or even ask questions. Once you've typed your message, press the Enter key on your keyboard or click the Send button. Your comment will then appear in the chat for everyone watching the live stream to see. If you want to send another comment, just type it in the chat box again and press Enter or Send. Your new comment will show up below your previous one.
Hospital. Good day. This is the Frankly Speaking Podcast 166. It's hard to make much of many of the complaints and allegations received by journalists, not least because some of them require medical knowledge and a place inside the facility. The complaints and allegations about bad medical practices and the poor services are sometimes a platform for political intrigue and one-upmanship, frankly speaking. But the fact is that public health facilities are under immense pressure, and people who use them have real issues over which to complain. Frankly speaking, what the ordinary man and woman sometimes call the health crisis or the health problem is not a figment of their imagination. But what are the professionals and the people who work in them to do? What is their response? We will hear answers shortly from a very qualified, experienced medic and administrator, Dr. Tanya Hamilton-Johnson. We are more than grateful to her because we are to wrestle these few minutes on Mother's Day. She said it's Mother's Day, which, frankly speaking, gives us the opportunity to say Happy Mother's Day to all mothers, biological mothers, adoptive mothers, mother figures. You all should feel truly appreciated today, if I know that. Which, by the way, gives me a chance to tell you about a new segment of the show you will like later on in the program. It's remembering and reaching back to old Jamaica. Or the premiere is focused on mothers, but we'll come to that. We thank you, our viewers and listeners, for logging on to today's podcast, number 166. We welcome your comments on the space provided using the procedure outlined at the top of the program. Also, we welcome your comments, WhatsApp at 876-503-9995. Desmond and Mary are off this week. Please remember to subscribe to the podcast. Subscribe to the channel if you haven't done so yet. And share the podcast with your friends and family. So, let's welcome Dr. Tanya Hamilton-Johnson, Senior Medical Officer at the St. Anne's Bay Regional Hospital and Consultant Surgeon. Dr. Hamilton-Johnson, please tell us what your job entails, and you have some time also to tell us what the state of the facility is at this time. And welcome again.
So thank you, Mr. McKnight. It's indeed a pleasure to be a part of your esteemed podcast. I have the utmost respect for you and your team. We have gone back far. And so therefore, it's my pleasure to speak on this topic. I am the Senior Medical Officer of St. Anne's Bay Hospital, a regional hospital, a referral hospital. My desk serves to be the hub that give a clinical oversight of the facility. It serves also a bridge between, an administrative bridge between clinical and non-clinical teams, and all in the name of treatment and healthcare delivery for every patient that comes through the facility. My job entails clinical coordination, coordinating the teams on the ground, internally coordinating the clinical teams externally, which includes the primary care team, the other hospitals. Indeed, we are a referral hospital. My role also extends to being a part of emergency management. as well as performing and ensuring that our clinical activities are quality and actually doing audits to ensure that we are performing at that level. My role also entails being a part of policy implementation and ensuring that policies that are implemented by Ministry of Health is followed and and followed to the T. And also in doing that, my role also entails actually documenting and assessing the clinical proficiency and reporting on a monthly basis to I report to the CEO as well as the regional technical director and also and via these people up to Ministry of Health. So indeed, it encompasses quite a lot in terms of, but all of these go towards delivery of care. St. Bay Hospital is a regional hospital, a referral hospital that offers services to 350,000 person, a population of that. It received patients coming from as far back of Portland, St. Mary, Clarendon, and the nature of the fact that we border these parishes. Uh, I'm proud to say sometimes they deliver services in 10 different areas. And and we are at a point where we see quite a lot. Our patient load is quite extensive. Last year, I'm going to give you the facts. And last year, and this is so important because of where it is smack. It's smack right in the highway, serving by a tourism hub, as well as our other parishes, as I said. And so, therefore, last year alone, we saw 40,000 persons, 47,000
Mm.
passing through A&E and being assessed uh, in various conditions. We admitted over 10,000 persons on the various wards. We do services through our clinics, where we saw 25,000 persons in our clinics. We do surgical cases. We did 5,000 surgical cases where, despite being limited to two operating suites. We continue to do. We have services which extend not only clinical, which extend from internal medicine, emergency medicine, obstetric medicine, pediatrics, anesthetics, orthopedics, general surgery, psychiatry, and have supported by paramedic staff, the labs, laboratory services, X-ray services, radiology services, dietary, which include nutrition and other care, in addition to physiotherapy. So we really have a good motivated workforce, which is supported by other staff, a workforce that amounts to 754 persons. We continue, and as I said, we see quite a bit of trauma. Our motor vehicle accidents are quite extensive. I think last year we saw more than the year before, 1,500 victims when we compare it to the previous year, which was 11,000 victims. We really open, we really support the staff. Our mandate is to continue to issue healthcare. We have challenges, and one of the challenges is that staffing. We still have vacancy. I know for certainly for the medical team, medical doctors, we have vacancy as amount to as much as 31. I think that was the last check. We have challenges in terms of our surgical services right now, and we hope to get back our suite. Two suites have been renovated, um, while we operate two others we use soon. But despite that, we manage, as I said to before, to achieve surgical cases continue. But we do have challenges where that is concerned. The other challenge we have is the overwhelming number of patients that we see on a daily basis. And so as a result, our wards, namely medical wards, the surgical wards, they're actually more than 100% occupancy on a daily basis. And as a result, you would have gotten complaints of persons wanting um, uh, to be admitted in a bed and some people waiting in chair. Something that we're not proud of. But we must say the population and the conditions have increased, which there's almost like a NCD pandemic. And so this is now touring on an institution of a size that never used to support as much condition as before. And so as time go by, our NCD conditions has increased. And we're seeing a lot of cases, and this is why our hospital, our medicine wards are always over 100%, especially the male medical ward, because of the sheer increased number of complications surrounding NCDs, the non-communicable disease. We see a lot of trauma as well. We still see a lot of trauma, and again, would explain the increased number of persons who are admitted on our surgical wards, and which always are orthopedic patients. So the good thing is that we do have a motivated workforce that has skills, and that is actually the right fertile soil to expand. And what is going to happen in the future, and I think you would have heard about it, is that we would have had plans to expand services, and that include expanding services to suit oncology, nephrology, gastroenterology, cardiology. And so therefore in the future looks good. The ICU to be supported, ENT services. And so therefore I really strongly believe while we go through the different challenges, I think our motivated staff, or the soil that we have, is fertile for growth and for delivery of care. But what I would want our public to have, though we have complaints, and so we have challenges, we are aware of the challenges of complaints of having to wait for bed space, have a bed position. But I would want us to believe in Sentence Bay, that we have the wherewithal, that ground to satisfy the delivery needs once we get support. So once we would have, and I know the team, the Ministry of Health, along with, is actually working hard to staff, where I would have told you that there are challenges in terms of staffing, to expand our staffing capacity, to achieve our strategic plan in keeping with our 2030, and you would have heard about that, plans. So this encompasses access of care, delivery of top level healthcare delivery to our general population. I speak passionately because I really believe we can get there, but we'll need the public to understand and work with us.
Wow, wow,
No,
Dr. Johnson,
indeed.
it's that's very comprehensive, but it
And
makes it
Yes.
makes you almost want to feel sympathy for the hospital. But I'm not saying Dr. Johnson,
no, but this is a real. I gave you a real life.
Yeah.
What's there's no.
yes, I understand. But
Yeah, that's
you mentioned some things there. So is it fair to say to the onlooker, to the user of the facility, the people out there who are saying, I can end up in that place anytime? Because that's how people think about the hospital. I can end up there anytime because, as you say, on the roads, whatever. Is
So
it fair to
McKnight-
say that the officials, and I'm not speaking about any particular government now, I'm just saying the officials or government officials have not kept the resources in pace with the issues that you have in terms of non-communicable diseases on the rise, in terms of the trauma cases on the rise? Is it fair to say that the hospital is not able to cope in the way that it should because of resources?
So I have as I said, I have a motivated and equipped team with expertise,
Yeah.
with critical on the ground thinking. Would have been one of the few hospitals that faced mass casualty. Around last year, it was about we had one mass casualty roughly per month, and so
All
therefore,
right,
because of
just explain that one
Yes.
mass cause, one mass.
Yes.
so mass casualty is when you have an increased number of patients presenting to your facility in a short time, which encompasses
Because of one incident, is that
because of one incident, which is normally
Yes.
on the highway a motor vehicle accident. Because of the trained staff we have, because you can have resources, but you don't have trained staff. Because of the trained clinical acumen and the team that we have, in most cases, we are able to manage in real time these situations because, of course, in this situation, would have had training in terms of mass casualties.
Casualty. Yeah.
Really, we are actually almost have simulation practices in preparation for these situations. So we know where we are. We have resource constraints, but in terms of training the team to deal with these challenges, we have on the ground training. And we have, so when a patient comes, we're able to manage them, even though the treatment would start immediately. So they might be sitting in a chair, but the treatment starts. And so therefore, I really believe as time goes by, as we get the resources, it will be improved. I don't know if it's fair to say that you need to just remind me of the question, but the other thing is,
The resources are, you don't really have the resources to deliver optimum care, top class care.
That's an interesting question because we have had to rely a lot on the clinical acumen, but also supported by one of the greatest things that had helped us was the MOH system where we had investigations done. But most of these cases were involved in investigations such as CT scan. And so therefore having that real, being able to investigate immediately is helpful in managing our cases. But I must tell you, because of the training and the ongoing collaboration that we have with the teams around us, we somewhat find a way to make use of what we have to treat patients. So I would say there are some limitation in what we have, but then we put things into place to ensure that whatever care we're delivering will be beneficial to our public. I must say, in answering this though, that there's a role for the public. And this is where, so there's a role for the public to understand. For example, I know the Ministry of Health, but we have been preaching and speaking about our health, or the importance of exercising, the importance of compliance with medication, the importance of healthy lifestyle. I'm just saying that to say that we need two hands to clap. And so therefore, for example, when we discharge patients and would have treated them and they would have gone out there, we're imploring that the necessary be kept up. We also, in terms of the trauma on the highway, with compliance with our road codes, these are things. So what I'm saying, whereas we might have resources, some of these and some of our management could be reduced if our public understand the importance of compliance with road codes, compliance with our healthcare healthy lifestyle, to reduce the recurrent admission. Lots of admissions, for example, to the medicine ward are due to readmissions, due to non-compliance of patients with their medication or non-compliance of our lifestyles modification that we are supposed to be taking.
Dr. Johnson, you did mention that often some of your wards are over 100%. What we understand by that is that people can't get a bed, people have to sit up in chairs, people have to sit on the floor, they're admitted, but they don't have anywhere to go. How long is that situation going to continue for much longer? And because it doesn't seem that you're going to be able to. That's been going on for a while, by the way. So can you tell us a little bit about that?
I'm just this. Most time people are in chairs and on stretchers. We really don't have anybody on the floors. It's important to stress that. And so therefore, not only that, it's important. We do have almost like we have a protocol where we attempt to try to get patients out of chairs within 24 hours of admission. And so what we do, that is called strict bed management. So every day, a ward run is almost like we have a machine where we do a ward run every day to enhance and to be able to practice strict bed management to anticipate discharge and this who can be discharged as early as possible to create space to have the intake. I know I would have been privy to be a part of an administrative team who would have anticipated that, yes, we need more space. And so plans are there to expand the medicine ward, especially the male side, to accommodate for more patients. But more importantly, I must stress, you would have been aware that Ministry of Health is actually working on a primary care model to also increase the number and reduce the number of admissions to our hospital. Because what would have put in what that would be means ensuring preventative care as opposed to this basic treatment. So I'm hoping with the increase in our primary care model that we'll see less patient being admitted. So yes, there are plans in place to reduce this cry. It's not something that we're happy about. And so therefore, what happens on a daily basis is almost like a revolving machine to get patients out of a chair to bed so that the management can continue in a much nicer environment. However, I hesitate to say that we don't prevent or stop treatment. Once you come to hospital, treatment starts in whatever state you are.
I have a
Whether
question
sitting,
for you.
Go ahead, Winnie.
Yes. I have a question for you, Dr. Johnson. And before I even ask the question, I really appreciate the hard work that you all do to keep things going. Do you have any of those patients that it's time for them to go home, but nobody wants to take them home? So they're taking up space. Do you have any of those patients?
yes, we have. And that's an excellent question. And so I would have mentioned that we have a set of clinical team with a very important department called the social work department.
Yes.
And so therefore, in a lot of situations, we would have had patients who we deem to be social cases. And due to the input of the social working department, they play a significant role in reaching out to the relatives and ensuring that these persons get to their home to create a bed space so that we can admit. So we do have challenge where that is concerned. But I must say, right now we consistently have five or social cases about number five. However, we do have times when it goes up to what we call patients who are likely to become social case. And so therefore what happens is when we anticipate this, we refer these patients to our social work department who consists of a team that mobilize and get to do visits, find a home to ensure that these patients get home. And so therefore, while I answer that question, I ask that the public also play a role in ensuring that they understand when patient comes to the hospital and they are discharged, that they come to us. We actually, what we do at times is advise them how to manage the patient home. Not only that, we keep what we call a follow-up situation. So yes, we do, but we have a social work department that assists us in getting these people home.
Dr.
Well,
Johnson, I
happy
have a
for that.
comment here from a viewer, and I'm just telling our technical man Joshua that viewers are saying that they can't get to put their comment up on the channel. So can you check that out for us in the meantime? But as you are talking a lot, Dr. Johnson, and you've emphasized how trained and well motivated your team is. But a viewer is saying when you go to the hospital, there are people faced with you and don't treat you right. Mm-hmm. Is there a sort of continued service changing about empathy, and other characteristics that one might show to patients? Because as you know better than I do, that people who are sick and turning up, they are most vulnerable. They need every sort of care that they can get. And they say that sometimes they get the opposite. Can you respond to that? Or staff, not necessarily medical staff, treat people who come to the hospital?
So I thank you for that question, because that is one of the main areas that's worrying. And I'd say worrying for our team members who are motivated. So we hear these things. We hear all kind of comments about how the public is treated. And as a result, it is a mandate of the Sentence Bay administrative team, as well as by extension, the NERA team, to ensure that there is a complaint management system in place that persons can lodge their complaints. So that's one first thing that we tend to ensure that is in, so that we can get feedback from the public, so that we can make the right changes.
So you have that system in place now?
So we have that system in place.
Yes.
The other thing we have is every hospital, including Sentence Bay, has a customer service department where their role is to ensure that a patient is seen in a somewhat, or their concerns are answered. Yes, you would have heard about it, and we repeatedly speak about it. It's on our so we are quite cognizant of the fact that there are persons that may have not been empathetic enough, and so ongoing training and take place through the HR departments, as well as the various departments, to ensure this is not so. What happened when such a complaint is lodged? We really take it another notch. We go down to the department level and assess to see where we went wrong and what correction can be in place. So this is an ongoing protocol, and it's something that I really think is a mandate of every member of staff, including the administrative member, to change that rhetoric, because it is a repeated rhetoric, and I think this is overshadowing the good work that we are doing. So, Mr. Frankly McKnight, I really think I would have heard it, and we are wanting this thing to change. And so therefore, whenever any persons are experiencing such a thing, we encourage them to lodge their complaints so that this can be addressed.
Dr. Hamilton, one of the things about care that we often hear is people have to wait long. Can you respond to that? People have to wait long. They come there from morning and they're still there in the evening.
All right. So whenever I said to you that 45 persons came to A&E last year, 45,000 persons. Whenever a patient comes to the hospital, they are triaged according to a system. And that system is known as emergency severity. Everybody got an emergency severity index, meaning based on your presentation, you're assessed. So you have emergency cases that are seen 1 to 3. And then you have emergency 4 and 5, which are the non-emergency cases. What holds up the delay is a lot of times, and it's something that a lot of times people don't understand, we would have to address the emergency cases first. So it's not a first come, first serve basis. It's based on your emergency presentation or your presentation of your clinical complaints. And so therefore, a lot of persons, while waiting, might anticipate that they're waiting long because they think that they are there long. And so, unfortunately, because their complaints may not be emergency, or they may not be urgent as the other, sometimes they end up waiting longer than the others. I must tell you though, the majority of patients who comes to the hospital is seen by a triage doctor on arrival. So the waiting comes when a lot of times they are now seen and have to wait on investigations. The sheer number that we have to deal with in terms of our emergency causes a delay in us not seeing the non-emergency cases. And so therefore, this is where, and understanding this, of that 40,000 persons who came last year to the hospital, 58% of them were in emergency. 42% of them were emergency. So I'm just saying to say, with the action or with the, we would want people to understand that if you're in a situation where you can go to the health center at times, it would be nice to, because what happened when you come to the hospital, you may have a delay because our focus has to be towards the emergencies. So it's something that I'm not proud of, and the team is not proud of this delay and complaints of delay. So what we do, we are putting things in place to ensure persons understand the flow through the emergency department. And so therefore it is also will be supported by the customer service team who ensure to relay the fears of waiting. So I hope that answered the question.
Yeah, it does, Dr. Johnson. One of the things that I wanted to find out from you is if you have enough doctors, not just plain numbers, because you mentioned that you still have some vacancies. Over 30 vacancies. I don't know if there's a medical clinical staff. But are there enough doctors here?
No. We are in need of specialists, especially we are in need of doctors. So
why don't get them? We hear that doctors are out there waiting to be employed. Why we don't get them? I know it might sound naive, but
all right. So
the need,
so that's such an interesting because I smile because we do have posts, and posts mean that you can get jobs and interviews can be done. However, I must highlight to you that where a lot of persons tend to have preferences for not the country areas, but for the town areas. I know you're aware of that. And so therefore what we find is a lot of times that persons tend to prefer the metropolitan area than the country areas. And that's that's a real factor. And so therefore when you have a delivery of healthcare system, you have to also have concerns about your social aspect, because if a person comes to if the person comes to
it's Mother's Day, we understand.
Yes. Yes. That's okay. In the meantime, I can just read may I just read a comment that came in from Keith B. Welcome,
yes,
Keith.
Go ahead, Winnie.
I must congratulate you for your great program. What kind of support do you receive from the private and public sector? How do you handle emergencies? Do you have adequate staff? You are speaking to staff at this point, Doctor. Yes.
Right. So this is where I'm saying that there will be ongoing recruitment to get enough staff to fill the vacancies. So right as we speak now, we don't have enough, but there are ongoing recruitment for our HR department to fulfill all the vacancies that are available. What we do, I like that question about emergencies. Whenever we have major emergencies that will need assistance, and this is why I talk about a highly motivated team, what happens is that where the emergency is needed, where the assistance is needed, there's diversion of staff sometimes from areas that are not having non-emergency to areas that are emergencies. So for example, in Mascot's situation, where we know that the staffing may not be adequate to deal with the sheer number, what happens is that there is an activation of a cascade, emergency call-out cascade, and we divert the staff. However, and this same thing happens if we don't have enough staff in an area. You find that there's a diversion of staff from another area to the another. But what that does is that it is a shortfall in areas that you have, for example, in areas that you need a one-to-one nursing, you can't because of the sheer lack of staffing. And so therefore, when we speak of staff, remember hospital is not just nurses and doctors, but other staffing too. And as I said, nurses, you guys know that we have an ongoing challenge where that is concerned in terms of nursing. So really, yes, we need staff. But what we do at times is make do with whatever staff we have with based on our training and ongoing simulation in how we handle emergencies.
Dr. Johnson, we have so many, and we want and we know we're not going to be able to have it as long as we wish.
Yes, sir, I'm willing to answer them. And
okay.
You talk about complaints. I think them need to be the public need to make use of us. We are available, and so therefore, I want them to know that we are here. We have a customer service department. They can reach me, and so therefore, really and truly, if they have concerns, don't just stay out there. We are here to serve the people.
Okay.
And I'm not making no speech. I understand our mandate.
Doctors tell us all the time, Doc, that about the importance of getting care fast after some serious emergencies. For example, in the case of stroke, they tell us that the amount of damage that you might suffer in the end depends upon how fast you can get to the hospital. But we gather that the ambulance system doesn't work. Can you comment on the need for speed to get into the hospital service and whether your ambulance system works at St. Anne's Bay Hospital?
So to remember, the ambulance system that we have is for the hospital. Yes. In terms of outside the hospital, when we do help, it's just we offering that assistance. But the ambulance service is really for patients at the hospital. In terms of, I'm just letting you stress that a lot, because a lot of times our ambulances actually engage in handling emergencies and other cases at the hospital.
And logistic things. So people must understand then, Dr. Hamilton.
Right.
But if you get sick at home, don't try to get the hospital ambulance. Is that correct?
Yes.
It might sound brutal, but that's what it is.
Right. That's what it is. Because remember now, we have a set of persons admitted to hospital. It is a 295 bed hospital. That, better believe it, it is like a machine. On a daily basis, you can have 5 emergencies wanting to go into Kingston. You can have another 5 waiting to go just to do a CT outside. And you can have other non-emergency that need a test to be done. And so therefore, if we are to say, send our ambulance outside into the public, you can see where we can get into problems here. So really and truly, the ambulance service for the hospital is for the hospital. However, that's not to say that when we are called and if there's an ambulance available, we don't respond. But I must stress that a lot of times, in terms of the share work from the hospital service, the ambulance are busy.
Okay.
Thank you. Before you go on, Franklin, another comment.
Ambulances now, Doctor. You have your quota of ambulances.
Hello?
I'm asking if you have your quota of ambulances.
We would need more if anybody is willing to give more, because what happened, we have ambulances that can survive. In other words, we have ambulances to satisfy our needs. However, as I said to you, the sheer number that comes to the hospital, the sheer emergency that we see, there are times when our ambulances are tied up. And there are times when we have to wait until we have return of ambulance from a specific area to come for patient. So in terms of numbers to serve the hospital, we manage. However, due to the sheer numbers, remember now, you come today and plan for, I'm just giving you a scenario. You come today and plan for a ward. And this is how health sector is set. But then you have 10 emergencies. And this can happen anytime. The number of ambulances might be inadequate for that emergency. To say that you have enough, I don't know if it's a fair say to say yes. There's always need for more because of the sheer number of emergencies that we can see. However, we do offer our service with what we have.
Okay.
Let's
get
Doctor,
this comment in, Franklin. Let's get this
go
comment
ahead,
in.
please. Go ahead,
Leon
please.
Bailey says, "Good afternoon. I must congratulate you, Doc, and all health workers. For me, no hospital can be adequately staffed unless we know how much people will get sick."
Thank you, Mr.
That's,
Bailey.
yes.
Um, and that's the question. We don't know how many people get sick. And that's how I've had utmost respect for health. You'll be okay now, and it's a quite
Yes.
nice A&E department. You like the calm before the storm. And in the next 15 minutes, you have pandemonium.
Hmm.
And I speak in this because I live it.
Hmm.
And so therefore, this is why Mr. Bailey comments is real, because you really don't know how much people are going to present the next day. And this is why you have people on duty and prepared at all time to respond to emergencies.
No, no,
So
this is
really and truly, but one thing for sure, there is almost like an ongoing increase in number of persons needing the services.
Doctor. This is the final question for today. I gather that the hospital is facing a new situation. That many of the people who are coming there now are older people because that's St. Anne is, I'm told now by others, is becoming almost a retirement community. With a lot of those schemes that are coming up and first community. But I gather that some of this you are now forced to deal with illnesses which are more associated with older people. Is that correct? And what's the challenge with that?
All right. So, and again, Mr. McKnight, excellent. Our population, due to healthcare being better, living longer. Our population, we're living longer than before. But we are also, in addition to seeing conditions affecting older people, we are seeing younger people being affected by NCDs, and younger persons being affected by hypertension, diabetes, obesity, renal disease. So yes, we're seeing the elderly, but we're seeing an alarmingly increasing number of young persons presenting with cancers. I stress it again, complicated from complications associated with diabetes, hypertension, obesity, renal disease. And so therefore, we're not only seeing the elderly, we're seeing the young persons. And we're seeing sudden people who have increased morbidity and mortality because of, almost like we need to seriously consider our lifestyle changes. And so therefore, yes, I agree with you, we are seeing elderly, but we must know that the population is growing, getting older there, and this is over time due to, and we notice that. But what is striking is that we're seeing younger persons with complications associated with NCDs. And so, in speaking to you, I would want to put a plug for the public to say, I mean, speaking to me too as I speak to you. I just telling you that we need to look at how we ensure that we get checked up at least every year, and for those who don't have any chronic illnesses. But let us also, when we have seen the doctor, be compliant with whatever orders are made. Let us start exercising some more, and let us start looking at how we can get screened for the various conditions, in terms of cancers, in terms of ensuring our mammograms are done, ensuring our stool tests are done, the various things that the doctors would have ordered, because we are seeing an increase. And better believe it, when we see the increase in number of admission, it reduces the resources. And no matter how much resource you push into the system, if you're seeing an overwhelming number, it's going to become depleted. So what you would have is a demand and supply kind of issue. And so therefore we increase our complaints. So while we at the hospital try to reach out and offer the services, I'm imploring on the public to also listen to the doctor's orders. If I have to
Oh,
use these words.
thank you very much, Dr. Hamilton Johnson, Tanya Hamilton Johnson. She is SMO and consultant surgeon at the Sentence Bay Regional Hospital. If you listen to her at the start, you know that she is responsible, but she's also reminding you that they do have a customer service section. She's available, reach a Black Hospital. I know that too. And we want to thank her and thank her staff for the service that they give, and remind many of them that they and we need to step up a little bit in the
And
service.
we have a CUG. I mean, we have a customer. I don't have it on hand here, but you see, a lot of people have concerns. I'm going to leave my CUG with their producer, and I'm
Okay.
always willing to um, answer calls and concerns, because I mean, I realize that sometimes people don't know who to call, but we have a customer service department that can handle this. And we want people to know that we can be reached. We're not away, we are for you. And
And it also helps if when we get good service, the ones who give the good service, we
to give
mention
a
them
feedback,
too
let us
in
hear.
the
So we
customer
don't
Yes.
want
service.
to hear the we don't want to hear only hear the bad news, but the good news.
Yes.
But we
Yes.
want to hear the bad news because we want to change how we practice.
Yeah.
My CUG number is can be given to your producer,
Okay.
Mr. McKnight.
We will get it from you. We'll get it from you, doctor.
Yeah, and so
And put it on you.
therefore, it's important that you feel, that you can reach out to us once you have a concern.
Okay.
This hospital is for the community and for you alone. And remember now, it can be me tomorrow who is admitted. It can be anybody. So it is for you. And I would want to address the issues, and we want to change to one day be for public to to access the service in a much of a good environment. And I'm telling you, the direction that we go in, and I feel it, I just know it, that I believe there will be improvements in years to come.
Thank you very much,
You
doctor.
must hear this comment before you go from Felix, and I'm not going to attempt to pronounce his last name. Luckily, I've never had to visit a hospital in Jamaica, but I once sat next to two nurses in a rude taxi, and I have to say, it felt like sitting next to angels.
Oh,
I love that.
wow, wow, wow,
I
wow,
love
wow.
that. I love
Okay.
that.
Thanks, Lord. Thanks. Thanks again, doctor. And as a committed doctor, she's a good SMO. She's an excellent surgeon. Our colleagues speak well of her, and we thank her
And
for
happy
doing her
Mother's
work in
Day
the
to
shield.
you.
Thank you. Thank you for the opportunity. Thank you.
Okay.
Thank you so
Good.
much. Yes.
So, people, we haven't decided on a name yet. We have a new segment for you, but we're not going to be able to do it today.
Oh, yes?
Are we? Yes. Well, Winnie,
I
you
don't know.
touch on the segment for us because we run out of time. Because our program is
Okay.
only 45 minutes today, back to 45. Go ahead, Winnie. Touch it for
Okay.
us, Winnie. Touch it for us.
Okay. Well, today's Mother's Day, so before I say anything else, happy Mother's Day to everyone. And we're looking back at Mother's Day. We don't want it to appear as if mothers, all mothers were always great. You always have the good and the bad. There was this story of this. Many people have heard this story of the mother who had her ear bitten off because her son was sentenced to be hanged. So that is a story that has been passed on from generation to generation. So I have to say that because what I'm going to say next, I don't want anybody to think that everybody was all very good. There has never been such a time in history. But what used to happen is that mothers were far more attentive to the children. Why? Because most mothers were able to stay home. They were not in the workplace. And they used proverbs and stories to help us while we were growing up. You're throwing stones, play stone, kill bird. This one on the screen was sweet nanny goat, I go running belly. So all these sayings helped us to keep in line.
Winnie, I want to challenge that. The sweet nanny goat have a running belly, but we are out of time. I'm going to have to get back to it next week. Winnie, I want to challenge that one, that it was not a good saying by Jamaican
I'm not saying
elders.
it was good. I'm not saying it was good. No.
Okay.
No, it was not good. It prevented people from laughing and having a good time. You're always afraid to have a good time.
Okay. Wonderful.
Yes. Yes.
Okay. People, we are thankful to you for joining us today. We thank Joshua for all of the preparation that he did. Joshua has a nice blog for us. He put a nice card there for you, thanking all the mothers. We thank you so much. That's our show today. Remember to subscribe to the channel. Special thanks to Dr. Tanya Hamilton Johnson, SMO at St. Anne's Bay Hospital. On behalf of Winnie Anderson Brown and producer technical man Joshua Black, I'm Frankly McKnight. Until then.